by profession. I practice nursing and I also lecture. So we are going to be examining a crucial topic this morning. It's of interest because um, it's been happening more frequently now. At least 2 recent cases happened specifically in Nigeria, and then I read one about a nurse in the US. So this morning, we are going to be looking at care providers of victims, the challenge of workplace violence against nurses. So this is the presentation outline. So nurses go to work daily to provide excellent care, and in order to achieve quality outcome and make positive difference for their patients. They don't expect to be victims of violence from patients, family members, or visitors, and certainly not from their co-workers. But they sometimes become victims of violence. That's a quote by Williamson, who is also a registered nurse in the US. So healthcare workers fall victims of violence 5 times more than an average person, and nurses fall victim more than other healthcare workers put together. So here is a graph of a study that was conducted across different countries. I actually reviewed this study, and then I was the one that came up with this graph. So as we can see from this graph, like you can see the statistics of victims of violence among nurses. And the list we can see here is 29.9. That's still quite significant. Imagining about 30 people out of 100 experiencing violence in their workplaces. So that's the list. You can see all the graph and all. So that tells you the importance of this topic. So what is workplace violence? Violence is any behavior involving physical force intended to hurt, damage, or kill someone or something. So workplace violence is any act or threat of physical violence, harassment, intimidation, or other threatening disruptive behavior that occurs at the workplace. So generally, violence can be categorized into 3: the self-directed violence, interpersonal violence, and collective violence. Self-directed violence involves an individual inflicting violence on him or herself, like suicide, committing suicide, and also inflicting pain on oneself. And interpersonal violence involves between 2 people, like a nurse and a patient relative, or a nurse and a co-worker. And then we have collective violence. This is more of a group of people attacking another group of people. And this is almost happening now in Nigeria. We can see the Fulani herdsmen clash, entering churches and killing people and all. So that's a typical example of a collective violence. So interpersonal violence. So because we are considering workplace violence, so I'm going to be dwelling more on the interpersonal violence. So under interpersonal violence, we have intimate partner violence and the community violence. So workplace violence is a type of violence under community violence. And there are 4 types of workplace violence. So the type 1 involved people who are not related to the organization, that's to that particular workplace, inflicting violence on people. For instance, if an armed robbery attack happens in the hospital, or rapist enters the hospital and then they violated people, that's a type 1 violence in the workplace. Then the type 2 violence involves people who are clients or customers of that workplace being the perpetrator of that violence. So a typical example of this would be a patient relative or a patient inflicting injury on a nurse. This is very common. Recently, I was discussing with some of my colleagues who are nurses, and one of us that worked in Akure was telling me that she's outside Nigeria now, that for a long time, when she was working at the A&E department of that hospital, for a long time, she does not wear a uniform to work. Because if they bring somebody to that facility and maybe for one reason or the other, the patient died, the patient relative beat up nurses. So you do yourself a lot of good by not wearing your uniform, so that if anything wants to happen, they will not identify you as a nurse. So that tells us how rampant that can be. And then the type 3 violence happens when somebody that is related to the organization, maybe a co-worker, is the perpetrator of the violence. While type 4 is the perpetrator of the violence is not related to the organization at all, but comes to inflict injury on whoever is the victim in the hospital, in the workplace, or in the hospital, as the case may be. So example of this might be somebody's ex-husband or ex-boyfriend or boyfriend coming to the hospital to harass, maybe if the nurse has relationship with him or her, or the co-worker in question. So the perpetrator does not have a direct relationship with the organization, but with the individual who is a victim of that violence. So this is a framework that helps us to understand how violence can happen, and then the interplay between factors, such that if these factors are properly addressed, we will be able to minimize occurrences of violence. So we have the influences. Those are factors that are the undertone for people that perpetrate violence. So it could be illness or injury. A lot of patients get embittered because they are sick, and then they feel they are not getting enough care from patients or relatives, from nurses, or they feel the nurse has not done enough, and then they become violent. And then social factor, people have they have different backgrounds to a lot of things. So at times, their response to a particular issue might be excessive above what is expected. Then the area of surrounding, there's areas are prone to violence. For instance, a female nurse working alone on a mental health ward, that already predisposes the nurse to an abuse. He's the only person, she is the only one, and then these are mentally ill patients that can come up with any abrupt behavior at any moment in time. So then we have psychological, and then behavioral and training. When people are not trained, for example, the case that happened at OETC, the training that people have that make them feel that nurses, they can send nurses on errand, and then when the nurse is now trying to maintain his or her stand, you see the other fellow trying to feel that the nurse is not responsible, or the nurse is rude, simply because you are refusing to do a duty that is not yours. So those are some of the factors that influence violence. And then again, we look at manifestation. Manifestation are ways by which people express violent behavior. It could be verbal or threat, like you will lose your job, or something like, are you okay? You are not good enough for the job, you are too slow, or something. And again, I want us to understand that workplace violence against nurses, we get there, that it's not even nurses against nurses. Violence happens between nurses. It could be from a senior to a junior, and they just make life difficult for you in the workplace. And then it could manifest in form of a physical abuse, beating or throwing some blows. And then the magnitude of here refers to how often is the violence happening, and how severe it's the effect on that individual. Is the person does the person have to take some time off work because the person has experienced abuse? Does the experience happens every day? So, and then actors, these are perpetrators of violence. They could be patients, could be family members, they could be colleagues, they could be incidental visitors or caregivers. All of these actors have been captured under the types of workplace violence that I mentioned. So, why nurses are at increased risk of experiencing violence? Some nurses have a higher tendency of experiencing violence. Example are nurses working at the emergency unit. Are we together?
Yes, ma'am.
Okay, please, if we are together, who can
Yes,
briefly give us reasons why people working or nurses working at emergency units of a hospital are increased risk of experiencing violence? Anybody who wants to talk?
Hello.
Okay.
Hello.
Yes, yes.
Am I audible?
Yes.
So I would say one of the reasons why nurses working at the emergency is because most of those cases are cases that need urgent attention and
Okay.
emotions are involved.
Okay.
For example, someone that brings the okay, that is it. I feel it.
All right, you are very correct. So emergency units, it's a rush place, and usually patient's relative or whoever brings in patients expect that their patients are attended to as soon as they get there, because they are fearing that the patient might die. So in the case of eventual occurrence of death, most of them get angry that if the nurse has done this, or if they have attended to the patient on time, that would not have happened. A few months back to something like this happened in Luth or in Lasso. I can't remember, that patient relative were beating up a patient because their relative died. And at times, some of these factors are beyond the reach of the nurse. The bureaucratic nature of the hospital also contributes to this. There are some hospitals that you are not allowed to attend to any patient until maybe they make deposits or do something or do some lab work. So the bureaucratic nature of some hospitals even make it tougher for nurses to act as promptly as they would want to. And not many relatives or not many patient relatives are aware of this. They just shift all the blames on nurses. And again, the psychiatry ward. Of course, this is expected, because here we have people that are not mentally okay, and even they can smile at you at 1 minute and the next minute they are attacking you. Then intensive care units. Intensive care units, for just like the emergency units, many people that enter intensive care units, again, some of them stay there for long, and then when they now eventually die, the patient relative feel they've done so much, they've paid so much, why would they die? And then they can start attacking the nurses. Then night nurses, night shifts is usually very solitary. We don't have a lot of people around, and the environment can predispose a nurse to being attacked. And the nurses that work alone, obviously, they are at risk. First of all, maybe because of overwhelming workload, and then because of an environment that is obviously not safe for them, and they don't have a second party that can protect them in case of any if any eventuality occur. I had an experience recently when I was still at the clinic. It was about closing hour. Many people have left the center. It was remaining myself and the doctor. So that was how a student came in. He obviously looked like somebody that just used the drug, and he was just hyperactive, a guy. So I had attended to him, I checked his vitals, and then he had gone to see the doctor. So the doctor sent him back to me, and the doctor too was about leaving. I just told the doctor that please don't go, just wait, let me attend to him, let him go, so as to avoid any story that touches. So, and then younger nurses, who can tell me why younger nurses could be at increased risk of experiencing violence? Anybody? Okay. In the absence of in the absence of any response, younger nurses, they are coming up. They are new into the profession. At times, some of them, that's their first place of work, and they've really not mastered many things. They might be prone to making some mistakes with some top manager who might not be patient, might not find funny. So the violence from this might not even be from patients or their relative. It might be from a senior colleague who expect so much from you. And then when you are not now delivering as she expected, they begin to feel like she does not know anything, she's too slow and all. So those are some of the reasons why a young nurse could be predisposed to violence. So what are the causes of workplace violence against nurses? Unmet expectations of patients or relatives. Like I've explained in previous slides, nobody wants to come to the hospital with their relative and then they now tell them the person has died. It takes a lot of self-control not to misbehave. So, or if they are not, their relative are not being attended to as quick as they want them to be attended to. Those are some of the causes of workplace violence against nurses. The inefficient organizational management. Now, in every organization, there are supposed to be policies on violence. If you are a perpetrator of violence, is it that you are fined, or you do something, or there is something you that makes you pay? So if such policies are in place, everybody will guide themselves. Many of our colleagues have left the shores of Nigeria and they are traveling abroad. I mean, they are practicing abroad. When they tell you what's operational there, you open your mouth that, is it still the same Nigeria doctors that do lot of all here that are working in abroad? So a lot of inefficient organizational management can result who is supposed to do what, when is this supposed to be done and how. So when the proper organizational policy are not put in place, nurses might be predisposed to violence. I keep on going to that OETC event because that looks like the most recent one and the most relatable. The law of waste management says whosoever generates a waste should discard it. So now it is completely out of place for a set of people to come to the ward and perform procedure, and then they are now leaving the waste unattended to. In the midst of all of that, most nurses that are traveling, that are practicing outside of Nigeria, there was one screenshot that was going about in one NHS hospital, that's in the UK, that, the notice is there. That's like a written policy on waste management. This tray should be cleaned after use, and then they included the name of everybody, even doctors. So if that is in place, there won't be any miscommunication. There will not be any misconception of who is supposed to do what, and there would not have been the case of somebody leaving waste for another person to discard. So then inappropriate professional communication. Again, ineffective communication, both inter and intra-professional, could predispose nurses to violence. And then factors related to nurses. Some nurses too, they have their own personal issues, which we cannot shy away from. Many people have their family issues, and any slight provocation, it becomes gas goes and everywhere gets heated up and all. And then factors related to patients, relatives, and other colleagues. So, what are the consequences of workplace violence against nurses? I'm discussing this both for nurses and then for the organization. So, there could be physical injury, when a violence is being manifested with physical abuse or physical force, people can sustain physical injury. Then psychological disturbances. In this part of Africa, or maybe let me say in Nigeria, maybe the social support that we have, it's a cushioning effect on our psychological health. But if you move outside Nigeria, you see, I listen to many nurses, Nigerian nurses who are outside Nigeria now, and then they tell you that they have to leave their workplace because the environment is not helping their mental health. So you see a lot of people, any workplace environment that is toxic to you can actually bring about psychological disturbances. So, and when we are saying a place is toxic, it means maybe there is a subtle emotional abuse happening in that place that you just feel choked. And that means a lot. Coming to work, and then the first thing you are hearing from your line manager is that you are not enough. You don't qualify for the job and all. So it could be it could result in psychological disturbances for a lot of people. Then intend to leave the job, just like I explained, that many people leave their job because the environment is toxic to them. Then work absenteeism. If someone sustains a physical injury, the person will absolutely take time off to recuperate from such injury. So work absenteeism and then decrease job satisfaction. Then on the organization part, an organization whose nurses experience a lot of violence will experience decreased nurses productivity. Why? If there is decreased job satisfaction, obviously it will tell on the quality of care such nurses provide. Then this will ultimately lead to reduction in client satisfaction. And then financial losses. The moment clients don't get satisfied, some of them might begin to contemplate not coming to receive healthcare in that hospital. And again, when people have to take time off work in order to recuperate from an abuse, it's usually named a sick leave, and as such, the organization is binded to pay the workers money even while on such leave. So that's a loss because this person is out, is not working. You have to hire somebody to come and perform his or her duty, and yet you still have to pay her for being on sick leave. So that's a lot of financial loss on the organization. And then increased employee turnover with retention issues. We talked about work absenteeism, intent to leave job as a consequence for nurses. So for the organization, when your nurses leave because the environment is toxic to them, so that means the employer will have to be sourcing for nurses from time to time. So how do we prevent workplace violence against nurses? I came about with these 3 P's that leads to prevention. That's policy, plan, and then practice. There has to be policies on ground to say that anybody that does this is what we act on. And then not policy on the perpetrators alone. And then there should be policy for whoever feels abused in the workplace, who to report to, the steps to be taken. And those policies should not just be written, there should be planned for their implementation. And then the practice part is the actual implementation of such plan. So if all of these things are in place, you will we be able to prevent habitual occurrences of violence amongst nurses. So the healthcare organizations too, on policy, they should have a zero tolerance to workplace violence policy, just like I said, and then let there be awareness on what causes violence, the consequences of violence to both workers, to the general populace, and the consequence on whosoever is found culpable. So, and then the public also should be educated on violence and its implication. So I think with this, we'll be able to an extent. And again, that's on the organization level. Then as a nurse, personally, this is a, we are being bewildered daily, where we are supposed to go and put our maximum best to ensure our patients are fine. And every day, there's a threat to your mental and physical health. So what are the things you can do as a nurse to prevent workplace violence? You must learn conflict resolution. As nurses, you don't have to make every issue, you don't have to take every issue personally. Learn how to resolve conflict. If someone does something that you feel this is really overboard to you, and if you respond at that instance, everywhere will be heated up. Just let it slide. And afterwards, when you have calmed down yourself, you can go and meet the person. Oh, please don't do this again. I really don't like it, right? So that way, next time, the person would have known his or her boundary. About last year or 2 years back, I was working with a particular doctor, and I attended to a patient, and then she sent the patient back to me. I can't really figure out what exactly happened, but she said something. Okay, she was about to set line, and then she, normally for me, even as a nurse, when I'm setting a line, I don't need an assistant. I do everything by myself. So now you want to set a line, and then you are sending me to go and bring syringe, to go and bring needle. Of course I did, because of my patient. And then the moment we were done attending to that patient, and I went to meet her, excuse me, it is not my duty to run errand for you when you are doing a procedure. After all, when I'm doing wound dressing, you don't speak anything for me. So please don't repeat it again. So subsequently, when she wants to set her line, if she feels she can't do it by herself, she calls the health assistant to help her cut plaster and all. So that's that. And the message might send them good communication skills. You work with people, so you must learn how to communicate effectively, both when you are right, and then when you feel that things are not going right, learn how to communicate effectively. So, and then you must know what the organizational policy says about violence. For instance, you are new in a place, and then every day there's this person that keeps threatening you, and there is a policy organization that says if anybody feels threatened, this is who to report, until maybe a day that you have really been overstretched, and then you now behave excessively, and that's now when they will say nurses own are too much. So you must know what the organizational policy says about violence. Then you learn how to diffuse tension, and then report any susceptible behavior. For instance, if you were in a shift, and then maybe in a psychiatry ward or in an emergency department, and you notice that a particular patient is becoming violent, you report the case, so that if anything happens, they would be able to trace it back that, oh, Because if anything wants to happen, there's a tendency for the nurse to want to defend him or herself. And you know, self-defense can result in a lot of things. So, but if that has been communicated earlier, nobody will now come and say that what the nurse did is too much for that behavior. Are we getting it? Are we still together?
Yes, ma'am.
Yeah,
Yeah.
So, and then you
Okay.
report any incidents of violence. It's very important that you report any incidents of violence. So, on professional organization, NAM and all, there should be a public awareness too, radio station and all. You know, the event that happened in OETC now, few weeks, about a week after that time, I saw a seminar that was prepared by the Director of Nursing Services, OETC, on workplace violence. And, you know, that was presented to nurses and all. So these are the ways that we can, and then educate the public, educate employees that no, workplace violence is not part of everyday life. It shouldn't be a common occurrence in the workplace. So this issue has important implications for nursing. So there has to be development of violence prevention and management strategies, and then report incidents of violence behaviors, research reliable data on workplace violence in nursing. Then nurses should be educated on workplace violence prevention and management, and then awareness campaign. So in conclusion, workplace violence against nurses is a significant, in fact, is a public health issue. It confronts nurses in developed and developing countries. So it's not only happening in Nigeria, it's happening everywhere. So there's grave consequences for nurses, patients, and even healthcare organizations. So proper policy, adequate plan in implementing the policy, and actual implement of the policy will help prevent workplace violence. So workplace violence is not part of the job. Any question?
No question. Workplace violence.
Yeah?
Hello.
Yes.
Yeah. Thank you very much, ma'am, for a wonderful presentation. I do think that workplace violence is a topical
You
issue
said,
that we really address. Hello.
yeah, please, can you speak up some more?
Am I audible now?
Yes, but you can increase the volume more.
Okay. I said
Yeah,
thank you
it's
very
better.
much, ma'am, for a wonderful presentation.
Okay.
I equally believe that workplace violence is a topical issue that needs to be addressed, particularly at this time.
Yeah.
Am I audible?
Yes, please.
Okay, so my question is as regards, I think the type theory that you mentioned on violence within the frame of emotions and behaviors, interpersonal in the world. For example,
Okay.
I had a case of a colleague that left a place of where
Okay.
she was working because the superiors were on her live and all that. She
Yeah.
complained that they had been frustrating her. So aside physical violence, I believe that someone
Yeah.
can be violated. Someone's emotional integrity can also equally be
Yes.
violated. So
Very
I-
well. Very well. And that's
my
what brings about psychological disturbances.
yes.
Yes. And then
So
we look at this, like I said, verbal, physical, and sexual. You know, when you say degrading things about people, it gets into them emotionally, right?
definitely.
Yeah. So
So
yes,
my
they are very
my
well.
my question as regard this is that in a situation whereby maybe you are the least in the chain of an organization or within the hierarchy of an organization, and you feel like you are being psychologically or emotionally violated by senior
Okay.
colleagues, how do you go about
Okay.
addressing it?
Now, you know, that brings us back to the policy that I
Oh, yeah,
talked about.
oh, yeah,
In this part of Africa or in this part of the world, little or no attention is being paid to emotional health. But outside Nigeria, it's a lot. It's a lot. So it depends on the policy on ground. And if there are none, then you might need to get evidence for yourself. Maybe when they are doing such things, you can take record. Because to a layman, if you go to them to say, this person is abusing me emotionally, it might not even make sense to them, right? But I think if you have an evidence, like, okay, these are that I feel is affected, and then report to whoever in that regard. Have I answered your question?
Yes, yes, yes. However, I think there are certain situations, even within the organization's framework or policy. I think there's this situation of internal politics that is being played within an organization. Sometimes, even when you report a senior colleague, you might be the one that will end up suffering. So
Very
that
true.
was what really brought up that question for me.
Yeah, you are very right. So the better way to do might just be to leave that toxic environment. I must tell you, that might just be the better alternative. And that happens
So
everywhere, not only in the hospital, even in admin, a lot of things happen that you feel like, really, I was the one being cheated, and then the whole table has been turned on my head. So it's not only in the healthcare industry, it happens everywhere.
thank you very much, ma'am. My question is
Yeah, you're
answered.
welcome. Okay. Any other question? Okay. In the absence of any question, I think Mr. Alumide, over to you, sir.
Thank you so very much, Mr. Adegboye, for the wonderful presentation. We always call on you and you always answer us. And for that, we are so, so grateful. And to our nurses and colleagues, I hope you had a great time with the lectures, because for me, I'm able to understand and also learn for employees who are less powerful, like they feel cheated, degraded, their emotions to also get crushed in the process. And that in one way or the other, be it in the healthcare system and the other sectors, reduce the productivity of such employee, be it a nurse and the rest. So for this presentation, we are so, so grateful. And I believe our nurses will also take all the pros and cons in order to avoid any form of workplace violence in their clinics and sick bays, and to also make sure they report such to the appropriate authority as soon as anything of such happen. So do you still have any other question, nurses? I don't know if you still have any other question. Okay, so in the absence of no question, I would like to appreciate you once again, Saladegboye, on behalf of our founder, Professor Abimbola Akintade, and the entire members, the staff, and of Ed for Nigeria. I want to say a big thank you to you for coming to deliver this wonderful lecture again. And I hope.
My pleasure.
And I sincerely, very, very sincerely, I sincerely hope that we'll call you again and you still answer us. You're already a friend of Ed for Nigeria now. So, and it seems our path is actually the same. So I believe we'll always call you and you always respond to us too. So, and we are also here too. Anytime you call on us, we'll always be available to respond to you. So once again, thank you so very much. And I wish you all the best too in your future endeavors and in your career too. Very soon we'll celebrate you as a professor of nursing science in Jesus' name. So once again, everyone, thank you so much for attending. And it's Friday. Do have a great weekend. Thank you.